levels and all abilities, but she has a particular interest in para-athletes and is the director of the Adaptive Sports Medicine Clinic at the University of Utah and head team physician of the U.S. Para Snowboard. She's with us now here and with U.S. Para Alpine and Para Snowboard, and she's put together something really cool. So with that, I'd like to hand it over to Meredith. Thank you so much.
Thanks, Mike. Can everybody hear me? Or Mike, can you give me a thumbs up?
I can give you a thumbs up and can hear you.
Great. So thank you for the introduction. I don't really have too much to add to Mike's talk. He did a wonderful job of outlining how we approach any extrication situation, and in particular following ATLS guidelines first, securing the airway and cervical spine, making sure the patient is breathing and looking for any bleeding disorders. But specifically in regard to extrication from we're going to talk about a monoski. That will really be the focus here of the next couple of minutes. So I have no disclosures. Let's see, my screen is slow here. Okay. So brief objectives, really just learning how to provide spinal stabilization in a sit ski, and then how to remove an athlete safely from a sit ski. So I think it's important to understand some of the most important parts that make this ski unique and things that you'll have to be considering when removing somebody. So similar to the sled hockey buckets, the bucket that a para-alpine athlete sits in is custom. Essentially, it's usually carbon fiber. Recreational models are available. They're usually kind of a thermoplastic, but still molded to fit the athlete. There's a shock that sits beneath them, which really isn't anything that gets in the way when you're talking about trying to extricate somebody. But then the ski itself, I do want to talk about that, and there are some important components that we'll look at a little bit more closely on the following slide. So the picture on the top right is what's called a block. And if you look at the picture slightly below that, that block sits between the binding so that the binding doesn't accidentally release when the person is skiing or if they're hit a bump or a rut. There's a second kind of safety step in there in that block is held in place by a cotter pin. It can be a strap, it can be a rubber band. There are any number of fixation devices. But before you release a bucket from a ski, which we'll talk about in a little bit, you have to make sure that you understand the components of the ski. So if you are ever working with para-alpine athletes, it's just a really good idea to talk to the athletes, have them show you their equipment, and most specifically, how their ski is attached to their bucket. So in snow sports or adaptive snow sports, particularly, we talk about, do you release the athlete from the bucket or do you release the ski first? And if you think about the mechanics of this, if you still have a ski in a bucket and you're trying to put somebody on a backboard or spine board, the tail of that ski is going to get in the way. So it really makes the most sense to take the athlete out of the bucket so that you can successfully and safely put them on a spine board if that's your primary concern. Additionally, the goal is to move the athlete from that bucket or out of that ski as quickly and safely as possible. And if you're spending time trying to get the ski off of the bucket, that's precious time that could potentially be wasted in getting them to a definitive level of care. So the only reason to really remove that ski is if removing the ski will facilitate improving your ability to get the athlete out of it. So if the tip is stuck in the snow, if they're in the bushes, kind of off through the fencing in the woods, that would potentially be a reason to remove the ski. And if you do have to remove the ski, you're going to have to remove the block and the pin. And then the binding itself is set at a level, the terminology that we use in ski bindings is called the DIN, which is the tension setting. Para-alpine athletes have their DIN at levels anywhere 2 to 3 times higher than the DIN on a recreational skier. So you really can't even get that binding off with your hand. It usually takes 2 or 3 people and usually a foot. So thus much easier to just remove the athlete from the whole setup. So our approach is very similar to Mike's And if you are, essentially the first person on the scene, you're performing the initial assessment, going through your ABCs. And with these athletes, if you have a high suspicion for spine injury based on the speed, based on the mechanism, you certainly want to get in and provide immediate inline stabilization. So in these scenarios, we always keep the helmet on. It one keeps the athlete warm, but two, as you'll see in the next couple of pictures, it actually helps with alignment when you're down there in the snow. And before you move the athlete, before you do anything else, you want to wait for additional help. So this usually takes at least 5, if not 6 people to do it safely, which is the goal. So the person who arrives first maintains the cervical spine. You're going to then bring in somebody to stabilize the shoulders, the hips, and the legs. The way we do this on snow is to place one hand on top, and you dig one hand kind of underneath in the snow so that you're compressing from above and below and providing as much compression and stabilization as you can through the spine. If you have an athlete with limb loss or there's a deformity, you can compensate slightly by, instead of controlling the shoulders, providing some compression kind of just below in the axilla over the thoracic region. When you stabilize at the hips, you're actually going to have to get your hands into into the bucket. So it's going to be between the bucket and the athlete. And then, similar to Mike talking about controlling the legs, you're going to have somebody who has good, firm grip on the legs themselves. Now, the athlete in this picture doesn't have a shield or a plate that goes over the front of their ski, but many of our athletes with intact lower extremities, like the picture up front, and I'll go ahead and reverse 3 slides, you can see that there's a plate that actually has to be removed before your assistants can get in there and stabilize. So these plates are held on by any number of fastening systems. They can be buckles, straps. Most often, they're actually snowboard buckles. So again, just get to know the athletes. Ask them if you can check out their equipment. They really love to show you all of the cool things that they've done to personalize their setup or their rig. So as I mentioned, when you're the first on scene, you're stabilizing the cervical spine. Ski slopes are pitched, they're often icy, the athlete is never in a good position when you find them. They're most often on their side. So the best thing that you can do is actually get down into the snow, use your body and your leverage, and slide one hand under, kind of gripping the shoulders, and one hand over to stabilize the spine. And you can use, again, that helmet to control the spine well. Next, we're going to move on to the shoulders, and these are tricky. I apologize. Just like Mike, we did these as a video the other day, and I pulled out some pictures. But the person stabilizing the shoulders, again, is providing compression from above and below. If you see in the picture on the right with the hips, he's actually reaching inside the sled, which is very tight. So he really has to get in there, grip, and hold her to stabilize. And you want to make sure that each person has firm control of their body part before you actually do anything. So it's very important in these scenarios when there's a lot of tension and stress. You have a lot of people who want to help, potentially people who are course workers, who are ski resort personnel or ski patrol who have never worked with an athlete in a sit ski. You want to use closed loop communication, and you as the leader have to be very clear and simple with your instructions. So I typically ask everyone before we do anything to move the athlete, I want to confirm, does everyone have firm pressure from above and below? Pause. Then you want to give the next instruction, which is release the buckles and straps. And this is very important to specifically direct, because once you release these buckles and straps that are under tension, holding this athlete in their ski, which is really like a ski boot, they might actually move a little bit in the boot. So once those buckles are released, you're going to tell them, we're next going to remove the bucket, but wait for my instruction. In our video, we had just fantastic assistance from the coaches, but they were so eager and wanted to help that they actually jumped the gun a little bit. So clearly state, we are next going to remove the bucket, but wait for my instruction. And then the most important step, and this comes at the end, is to ask the team, is anyone not ready? And this gives them the opportunity to speak up. And the final command is, I typically say, on my 3, pull down and away. So we count 1, 2, 3. The person at the head is stabilizing the cervical spine. That's me. You have firm control through the shoulders, through the pelvis and the legs. And then 1 to 2 people, typically the person who's released the buckles and an additional person will take and pull that bucket, which is very, very tight, down and away from the athlete. So the picture on the left shows the hand position, the picture in the center shows the beginning of removing the bucket, and the picture on the far right shows the bucket pulled away. So if you have the opportunity to perform, kind of get to that D step and move into your secondary survey while you're waiting for somebody to bring a spine board in, it's a great time to quickly examine the cervical spine, the thoracic spine, the lumbar spine. You can palpate midline, paraspinals, look for any tenderness or step off. If you don't already have a sense of what's going on at the pelvis, in other words, is there any crepitus or instability, you can more closely examine the pelvis. You can look at the extremities, the long bones, and obviously observe for any bleeding. But don't do this if patrol is there and they have a board, because this can delay definitive care, which is the most important and final step. So if you are going to place this athlete on a spine board because you do have concern for spinal injury, you want to use all 6 people. You're going to place the board essentially along the spine. And the nice thing about the snow, which is a little bit different from the ice, is that we can actually kind of dig the edge of the board into the snow. And it creates kind of a really nice roller transition of bringing that athlete back into supine. So the one thing to consider with our para-alpine athletes, and we often have to remind patrollers, is that they'll have lower extremity tone or spasticity, and they might also have some joint contractures. So whatever you can do to support their natural anatomy by placing blankets, pillows, jackets, anything underneath either typically their knees or even under their heels. So, and again, I can't emphasize enough that as nice as it is to do a little exam when they're inside lying, it's much easier to complete your exam and manage an airway when they're in supine. Thanks everybody for listening, and I know none of my coaches or staff are on here, but they just did such a phenomenal job helping me put these slides together and